guys, I hope your week is going well. So today I'm going to talk, as promised, all about treatments for keloids. This is a follow-up to my prior videos about scar overview and then lasers for scars. So if you missed those videos, I will list them down below in the description box. Make sure you check them out. But today I'm only going to be talking about some of the most common treatments for keloids. Keloids, if you're not familiar, are a type of abnormal scar tissue, most common in African Americans, darker skin types, but can occur in anyone. And they are the result of kind of an abnormal production of some of the collagen that normally is laid down in our skin when we have a wound, as well as a kind of disrupted milieu of growth factors that are normally important in a wound for healing the wound. In keloids, those growth factors sometimes are increased, and some of the cells in the keloid itself seem to have a hypersensitivity to the growth factor. Overall, however, the science behind why keloids form is still developing, and we don't know entirely why keloids form. There are a variety of different types of keloids. For the most part, one of the most common types is one called a post-incisional keloid, which, as the name implies, generally occurs after you've had an incision or a cut, maybe after a surgery. These are most common in areas of high tension on the body, like on the chest, the sternum area, on the upper shoulders, but they can occur anywhere. Secondly, one of the more common types of keloids out there are earlobe keloids that can occur on the earlobes, usually after an ear piercing, particularly if the ear piercing was done after puberty for whatever reason, as well as if the ear piercing was somehow traumatized, the track of the ear piercing, maybe got infected. That can set the stage for keloid formation in someone who is predisposed to forming keloids. There are also these random spontaneous keloids that can occur, and the individual or the patient has no recollection of ever having any injury there. They just crop up. I've seen these on the upper back in young women, and there's some thought that maybe there was a prior injury there that perhaps the individual didn't recall, and then later on the keloid developed spontaneously. It's really not known, and they're kind of a mystery, but they do occur. And then the fourth type of keloid is one that, for the most part, largely occurs in men, and it's called acne keloidalis. Acne keloidalis is a type of inflammation around the hair follicle itself. And it's a chronic inflammation around that hair follicle that results in the formation of a tiny little keloid bump around the hair follicle. And it has a tendency to occur on the back of the neck, the back of the scalp, the lower hairline. And with time, those little tiny keloids actually coalesce or group together into a large keloid plaque that can be very disfiguring, uncomfortable, and also no hair grows through it. So it's like a bald, thick scar plaque that is very uncomfortable and very bothersome to the patient. So those are some of the common types of keloids out there. There are, a few other subtle differences and subtle types, but those are overwhelmingly the majority of the types. So first of all, I think I mentioned this in one of my other scar videos, you can actually have the keloid excised. It's a little bit tricky, and many providers don't feel comfortable doing this. Because when the keloid or the keloid scar is cut out, you can just remove it by cutting it out. When it is cut out, there is a high rate of it recurring. People who form keloids after surgeries, after cuts in the skin. So cutting the skin to get the original keloid out, you can imagine, logic follows, you're just going to get another keloid. So there's a high rate of recurrence, and it's kind of like, well, why even bother with that? However, if done along with some other treatments at the same time, you can get some improvement and lowered rates of recurrence afterwards, and many people have good success. Personally, I've had some good successes, and so long as there are some other things that are either injected or used alongside. Then after the excision, the open skin is allowed to just heal on its own. So no sutures are typically used. And that's one option. The keloid subtype that tends to do best with excision and has the lowest rate of recurrence, and is usually the type that is selected, is the acne keloidalis that I mentioned. That large plaque that can form on the back of the scalp actually can be much improved with just excising it, and a much lower risk of recurrence than like an earlobe keloid, for example. Kind of going alongside the idea of cutting the scar out, sometimes depending on how the keloid is shaped, sometimes the keloid will actually kind of be what we call pedunculated, or on a little stalk, almost like a little mushroom. And in those cases, sometimes the base of the stalk the surgeon can actually ligate it, which kind of basically kind of asphyxiates the keloid a little bit, and it can fall off. That doesn't always work out so well, and you have to be very particular as to the type of keloid that you're going after, but that is, in some instances, can be helpful if done correctly. This is not something that you should try and DIY at home by tying like dental floss around your keloid or anything like that. That can be very, very dangerous. This is something that a surgeon may pursue, a skin surgeon may pursue, but you should not try that at home. It can be very, very dangerous. A third type of treatment for keloids that is the mainstay and has been around for many years is to inject the keloid with varying concentrations of a steroid. One of the more common steroids that is used is one called triamcinolone, or Kenalog is the brand name. There are a variety of other different types of steroids that can be injected directly into the keloid, and this has been the mainstay. This serves to help atrophy the scar. If you'll recall back to my video about topical steroids, steroid creams, you'll remember that I said a side effect of that is actually a thinning of the skin and the formation of atrophy, or almost a stretch mark. That's actually kind of what you would like in a keloid, right? You kind of like it to shrink down and atrophy. So injecting steroid into the keloid, it has been a mainstay for keloids for a long time. It can flatten them. A lot of times keloids will itch and be uncomfortable, so it can improve those symptoms. The improvement with this approach, however, it generally doesn't get rid of the keloid completely at all. And the improvement, sometimes you'll see about roughly a 50% recurrence, so it's definitely not perfect. And it has to be the injection of the medicine into the keloid, so intralesional. So it does involve a needle. So for patients who don't like needles, it can be uncomfortable and they don't like it. You have to have several injections, spaced on a monthly basis, to really get good results. You can't just have it done once. And unlike the injection, which can be helpful, steroid creams and steroid ointments do not touch a keloid and are like kind of a waste of time. Unless it's itchy on the surface, sometimes a steroid can be prescribed to sort of help the itch, but it's not going to get rid of the keloid. It's simply too thick to allow penetration of really any topical steroid whatsoever. But intralesional steroids, either on their own, have been used for a long time, but in conjunction with excision, which I mentioned previously, can get good results with a much lower rate of recurrence of the keloid. It can lead to flattening, improvement in symptoms, and a much lower rate of recurrence than either approach on their own. Then another approach that has been tried since actually the 1600s is simply to put pressure on the keloid. And basically how this works is it kind of decreases blood flow, throughout that abnormal keloid tissue, kind of asphyxiates it, similar to the ligation that I mentioned previously. This has been tried for keloids numerous times. It's not as effective for keloids as it is for just ordinary thick scars that regress on their own. It doesn't tend to be as good for thick. It doesn't tend to be as good for keloids as it is for just thick scars, or what are called hypertrophic scars. I talked about those in my scar overview video. The one subtype, however, of keloid that does respond to a certain extent to pressure are actually earlobe keloids that can happen after you've had your ears pierced. Specifically, it's very difficult to do if you're a patient, but putting pressure on the keloid continuously from anywhere from 8 to 24 hours for 6 to 12 months, so really hard to keep up with, can really help the keloid. So much so that a lot of providers, I've tried this myself in patients and had decent results, only in patients who are willing to tolerate the pressure. Good results with using these alongside, like after an earlobe keloid maybe is excised, it's the patient keeps coming back for injections of steroids into that area to keep it from coming back, and then they are wearing a device to put pressure on the earlobe. There's a company called Delasco. I'm sure you can get them on Amazon. They're called Delasco. They basically look like a flower press, if you're familiar with that you clamp on your earlobe. Really hard to keep up with, but they deliver the right amount of pressure to the ear. There are case reports of people using binder clips as another approach. That has been reported in the medical literature as well. Another treatment that has been tried for keloids is cryotherapy, and by cryotherapy I mean delivery of liquid nitrogen to the surface of the skin with a specialized device. I'm not talking about, nowadays they have all these like cryo spas where you can go into this room and like chill your body. I'm not talking about that. That is, kind of a gimmicky nonsense thing. I'm talking about selective delivery of liquid nitrogen vapor to the surface of the skin to destroy a skin lesion. It's commonly used for many skin diseases in dermatology, to get rid of warts, to get rid of little pre-skin cancers, to treat skin cancers. It's in the office and it's used for a lot of things, so naturally it has been tried for keloids. And there is some data to show that you can get pretty good improvement in both pain, itch, discomfort associated with the keloid, and some reduction in size. Generally, this would be reserved for really small keloids because delivery of liquid nitrogen to the surface of the skin, first of all, is not pleasant. It's uncomfortable, and so to do it on a big keloid, most people can't tolerate that. It's very uncomfortable. Also, there's a side effect potential of developing darkening of the skin as a result of basically this destruction that you've done on the keloid. You can get darkening of the skin, post-inflammatory hyperpigmentation. So it's generally reserved for smaller keloids, and that's something that as a patient, if you're asking about, be aware of, like, well, if it's a keloid in an area of the body that is really apparent, you may not want a dark stain there. But if you really just want to try something to get rid of it, and it's somewhere else on the body, and it's more the size or the symptoms associated with it, cryotherapy is an option, to discuss with your dermatologist. And then I already did, like I said, a video on lasers for scars and keloids, but just to reiterate what I said in that video, probably the laser of choice for a keloid would be a pulse dye laser, which is a laser that largely targets some of the blood vessels in the skin. Specifically, it uses wavelengths ranging from 585 to 595 nanometers. And this laser is helpful kind of in the early stages. If you're somebody who already knows that you formed keloids and you have to have like a surgery, whether it be elective or non-elective, it's something that can be helpful kind of at the time of the surgery to reduce the chances of you forming you forming a keloid. It targets those little blood vessels. Not only can it help, in some cases, the keloid regress, help reduce the chances of forming one, but it can help with the it helps with redness. If the keloid is red, it will help with that quite a bit, and it can decrease both itch and pain. So, you know, those are things that are patient-specific goals. You may not care, you may not have those symptoms, they may not be relevant to you. That may be like some of the main stuff that's bothering you. I've mentioned this in other videos, but silicone gel and silicone scar sheets are really helpful as part of treating keloids. They don't do a whole lot on their own to get rid of a keloid. They're not going to get rid of a keloid just by wearing a silicone gel scar sheet like ScarAway. I happen to be a fan of that. But when used after excision, they lower the chance. Using a scar gel or a scar sheet after you've had a keloid scar excised will lower the chances that it recurs. And if you're somebody who knows that you form keloid scars already, planning to wear a silicone scar sheet can reduce the chances of formation of a keloid there. It has to be used immediately once the skin starts to come together after you've had a cut or incision, and it has to be worn for a minimum of 12 hours a day for 2 months to get you that benefit of reducing reduction. So, for example, say you have a cyst or some sort of skin lesion that you have cut out, or you have a surgery on your chest and the area is closed up, or a C-section. You know, you form scars very easily. You know, you form keloids. Really what you would discuss with your treating healthcare provider as far as a preventative measure is, once the skin has healed over, to be wearing a silicone scar or ScarAway sheets there. Make them in a variety of sizes, and you would wear it at least 12 hours a day. And for 2 months can really reduce the chances of forming both a hypertrophic scar as well as a keloid. Very rarely, you know, some providers will try radiation therapy for keloids. It actually can help quite a bit, and it can be used on its own as monotherapy to treat a keloid, or it can be used after the keloid has been excised. It's typically reserved, however, for really, really treatment-resistant bad keloids that maybe have already come back and, you know, are just really challenging. There are more risks associated with radiation for a keloid. It can cause some pigmentary changes, kind of like what I described with cryotherapy, some post-inflammatory hyperpigmentation. And there is also a risk of skin cancer formation after radiation therapy to the skin. It kind of alters the texture of the skin, but non-ionizing, specifically radiation therapy for keloids, has been used and is an approach that may be selected and may be appropriate. Outside of injecting steroids into the keloids, there are a few other compounds that some providers try. One such drug that is commonly injected into keloids is something called 5-FU, or 5-fluorouracil. 5-fluorouracil is basically a chemotherapy, believe it or not. It's given to treat a variety of cancers. It's also delivered to the skin to treat skin cancers, and it can be injected into a keloid and cut down on that abnormal proliferation and biology in the keloid and help it regress and reduce the chances of it forming. It can be co-injected with steroids to give optimal results. They work really well when combined together. Personally, I've had very good success with with a combination with an injection of intralesional steroid, triamcinolone, in combination with 5-fluorouracil. You can't be pregnant, however, to get the 5-fluorouracil, because it is an anti-metabolite. It can be absorbed systemically, so it's contraindicated if you are pregnant. but otherwise it is safe. So oftentimes, if you're a woman of childbearing age, the provider might ask that you do a quick in-office urine pregnancy test just to make sure that you're good to go. But that actually can really be helpful along with steroids. And then there's another agent that can be injected called interferon. I personally haven't ever used this for keloids. Interferon is something that our body makes when we get the flu and we feel sick, and it can actually help to put the brakes on the keloid growth. It can be used on its own for keloids, or has been used. Patients tend to not like it. Nobody wants to feel like they have the flu. And results are, I don't know, kind of all over the place. Some people see good responses. The last thing that I will talk about is onion extract, because I get many questions about this, or allium, which is basically onion extract. That is what is present in like Mederma, for example. And it is thought it contains a high amount of something called quercetin, I think I'm pronouncing that right, that is thought to potentially be irritating to the keloid and help it go away. There was one tiny study that suggested it might be helpful, but follow-up studies since that time have not corroborated that finding or found it to be helpful at all. So I don't really, tell people to go chasing the Mederma thing or the onion extract. And if anything, it can be irritating and uncomfortable. So I don't find it's helpful. And to me, the silicone gel, the silicone scar sheets are a much more logical, evidence-based, rational approach. But I hope this video was helpful to you guys. Keloids are an incredibly uncomfortable thing to have to cope with. They can limit mobility, as I said in some of my other videos, and they are disfiguring, and they can really, really, really impact your overall quality of life. So I hope that this video was useful as far as kind of overviewing treatments and what there is out there. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe.